Hello, my name is Priscilla. I am one of the lab assistants at the College of DuPage Nursing Department. The objective of today's video is to display how we run our IVs through our mannequins that we use for simulation. Preceding times have shown us that although the vast majority of our mannequins have a pre-installed vascular system, they are prone to perforation and thus potentially mold. So we have designed our own external vascular system so that you can utilize the standard IV piggyback medication, a patient-controlled analgesia, or a syringe pump utilizing this method. The intravenous setups for all of our mannequins are essentially all the same. They consist of an IV source, which may be a separate bag, an infusion pump, a patient-controlled analgesia, or a syringe pump. They all have primary tubing, which consists of a length of a tubing that has lure lock adapters, either 2 or 3, and also an airlock, which prevents backflow. The second portion is our drainage bag, which is an empty IV bag with a short piggyback tubing. You will notice that it does not have any lure locks, nor does it have an airlock. Having an airlock on any of the tubing would prevent drainage into the drain bag. We'll now proceed with the intravenous setup for the external application of fluids to our simulation mannequin. The setup for the infusion consists of the IV site, which is started in the non-electronic arm of the mannequin, the standard IV dressing, a J-loop. There are similar ones out on the market, and they may look a little bit different, but they're all quite the same. They consist of the J-loop with the slide clamp, and this is in the tight position, which will inhibit the potential flow of fluids into the IV mannequin's arm. We also have the 3-way stopcock. It has 3 ports, 1, 2, and 3. The long handle of the stopcock arm is pointed in the direction that we need to be off. So for this model, it is in the direction of the IV. The second port is where we will place the drainage bag, and this port is where the infusion will be handled. It is connected to a lure lock injection port. I will now demonstrate how the intravenous tubing is attached to the 3-way stopcock. For our purposes, this is a non-sterile technique. However, when you are practicing your IV tubing changes, it will be based on the policy and procedure for that skill. We will now proceed with application of the primary tubing to the lure lock port. We ensure that the slide clamp is still placed in the tight position. Because this is a non-sterile technique, I do not need any alcohol. My tubing is primed, and I will attach this, pushing and twisting. It is now attached. Next, we will place our IV drainage bag along with the standard short piggyback tubing. The piggyback tubing is placed on the 3rd empty port, just placed with an insertion and a tightening of that lure lock, just finger tight, and ensuring that the slide clamp is open to promote drainage. We will now place the drainage bag in the proper position for the infusion to run. The slide clamp remains open. The bag is placed on the hook directly beneath the bed frame. Our IV external infusion setup is now complete. The bag, you see, is now infusing through the tubing and down to the stopcock injection port. The 3-way stopcock is off to the patient. The slide clamp is tight, and the drainage is coming to the drain bag with the open slide clamp. I would like to thank our mannequin and our camera director, Chris, for this video. I hope you will find it beneficial in the IV setup for your various platforms.